So, good morning, everybody. Good evening, good afternoon, wherever you're at in time listening back to this podcast. This is, I'm not sure which episode this is, actually. I think it's maybe 4 or 5.
I think 5.
And
Look at us just rolling them out.
yeah, this is a new project that we have kicked off here on Pain Geeks to support our reflections of every month's readings and to be able to share with more people what it is that we are discussing every month and the things that we're thinking about, and how we are integrating these readings into our clinical practice and into our lives as clinicians slash human beings. And it's because we talk about a lot of really cool stuff, and we always think it's such a shame that, more people don't get to be a part of our discussions because I know when I can only speak for myself, of course, but I know that after every discussion, I always feel very inspired, very motivated by all of the discussions and by all the other clinicians who are really dedicating themselves to their work and taking time to just reflect and to be vulnerable and to try to be better at their job, and with the people sitting in front of them. So that's really cool. It's nice to be a part of that process. We had a particularly interesting theme that we've started this quarter, one that I think is dear to both of our hearts, psychologically informed care. Obviously, Laura teaches as well acceptance and commitment therapy, part of the psychologically informed framework. And I as well have done some training in that and have started implementing that into my clinical practice for a few years now, and really changed the way that I think about my work and how to approach cases. So it's a very meaningful approach and philosophy that we are happy to be discussing this quarter. So that being said, we'll just do a quick little introduction and then I can explain a little bit more about that. If you don't know who we are, my name is Christine. I'm a physiotherapist, living and working in Cyprus, originally from Canada. I lived in the Netherlands for many years, which is where Laura and I met. And yeah, I am, just I'm a general physiotherapist who is interested in pain, who is interested in being psychologically informed, and trying my best to just apply everything that I'm learning in a responsible and as effective way as I can in my everyday clinical work. And I think a big part of that journey has been not only, understanding and learning about communication skills and reflective processes, but also the personal development that I have done to sort of ground, a lot of that work, which, interestingly is also part of a psychologically informed approach or philosophy. So we'll talk about that as well. Laura, do you want to introduce yourself?
Yeah, so my name is Laura Rathbone. I am a pain specialized psychologically informed physiotherapist, right? And yeah, the article that we studied this month as well is also just one of my I have a real special corner of my little nostalgic heart for this article of because it's Vicky Harding, and I also had the great enormous honor and privilege of working at Input Pain Management Team in St Thomas's, unfortunately after Vicky had retired, but the influence of her understanding of how psychology frameworks are not just an additional tool to physiotherapists, but physiotherapy is inherently cognitive and behavioral. So she really embeds it in that framework. And I think that has stuck with me as I've sort of gone on and taught and been sort of explaining or exploring what it means to be a physiotherapist that is also um, therapeutically working on psychological processes in order to improve uh, and support the patient more, improve the outcome for the patient basically, and support them to move through this therapeutic process that we call physiotherapy. So I really, like you say, this quarter is obviously very professional, but that makes me very biased because I've got this sort of personal connection, this sort of real admiration and for the work. And of course, Professor Amanda Williams is just one of the most incredible researchers in the pain field. She's done so much for us in terms of understanding psychology and how it pertains to pain. Um, and it's just wonderful to share. I think it's just wonderful to share these really influential women in our field as well, which we love to do. Because
Mhm.
it's still a boys' club.
Mhm. So that's good. And we did read this article called Applying Psychology to Enhance Physiotherapy Outcome, which was written
Mhm.
indeed by Vicky Harding and Amanda Williams. It was an editorial piece made by them back in 1995.
Yo,
So
in the late
late
1900s.
1900s, quite a while ago. Doesn't feel like a while ago to any millennial listening to this call. But
It was
in the
30 years
reality,
ago.
yeah, it is quite a while ago.
Vintage now.
Yeah. And, this was also part of our discussion as well, because it was, a reflection on if we can really contextualize that time frame and understand what it was like, what was the sort of the historical context, or the what was the prevalent or the dominant sort of theories coming out into physiotherapy at that time, which was heavily sort of manual therapy type of research and ideologies. That this paper was really different, really
Mm,
ahead of its time, certainly ahead of its time. We can confirm that now because when we
mm.
read it, it doesn't seem that crazy at all. It seems
Well,
very logical, common sense.
it's
Hmm.
still very like when you read it, you're like, huh, yeah, we could if we could be doing this, this would be nice.
Yeah, yeah,
Like,
yeah,
wouldn't we have evolved as a
yeah.
profession if we were if we were if we were just recognizing that,
Hmm.
motivation and mood is an
Hmm.
inherent part of how we of the physiotherapeutic process, right? Like
Yes.
not an addition, but an inherent part of it. Like that would we're still not there yet. So it's
Yeah.
so far ahead of its time. It's still progressive, even 30 years down the line.
Yeah, that's for sure. And so we had some questions, so
Mhm.
in maybe I'll give also a little bit of a description of how our discussions and how our themes and everything work. So every quarter, so every 3 months, we pick a theme and we read one journal article.
Mhm.
1 month, we'll read a second journal article around the same theme the next month, in the second month. And then in the third month, we focus on discussions around our book club book, which we've been
Mm,
reading throughout the entire quarter so that we have a little bit more time. And so
mm,
this is the first paper of this quarter of psychologically informed care. And we will be reading another paper in September in line with this theme. So that's really exciting. So this is just the tip of the iceberg in terms of our discussions. And every time we read a journal article, we have two discussions around
yeah.
it. The first one is a little bit more about orientation around, what kind of paper is this? Where has it been published? Who are the
Mm,
authors? What can we expect from this kind of paper? And what are sort of our expectations for it? That kind of
mm,
thing. And our second discussion is always with a humanities piece included. So we'll choose a piece of art or music or a video or a poem or something along those lines. That we feel ties sort of loosely into the theme that we're exploring. And then we have a little bit more of a detailed discussion about the paper and reflections, what we've gotten out of it.
Yeah.
So that's sort of where we're at now. We've finished our first month. We've had both of the discussions for this paper,
Mm.
and we've talked about a lot of different things around psychologically informed care, like how it's a philosophy and an approach, and not especially like a treatment, a specific treatment approach, but there are many different types of treatments included within that psychologically informed framework. But we're going to talk about that more when we go into these questions. We
Mhm.
talked about psychological principles. We talked about things like what's the difference between being a psychologically informed practitioner and just being an empathetic practitioner. That was a very nice question that we explored, and things along those lines. And of course, our humanities piece, if you want to check that out, it's also you can find it in the platform, the online platform that we have, our community platform, Pain Geeks. And you can also find it on our Instagram.
Mhm.
We looked at a statue from the Hellenistic period of Laocoön and his sons. We're not sure
Yeah.
exactly how it's pronounced.
Yeah.
And it's just a beautiful statue. Uh, um, Representing the sort of, it's been said throughout time to be sort of the iconic picture or face of agony, very
Yeah.
detailed, expressioned marble statue of a father who is suffering punishment of the gods alongside his sons. Um, so we explored that as well this month.
Yeah. This statue, every time I look at it, affects me in some way, right? Because it's so,
Hmm.
I mean, it's so old, right? Like, first of all, and it just represents the, like, I don't know, this kind of the experience of pain and suffering and distress that is so human, and yet here we are still struggling to accept and acknowledge that
Hmm.
it that to be human is to experience the, of course, the beautiful things in life, but also these very difficult, profoundly distressing, life-changing events.
Yeah, yeah. It is good to have that zoom out sometimes. That's for sure. Otherwise, it can be, yeah, get a bit sort of focused or narrow in our perspective. So it's good to be able
Yeah.
to sort of shift between those. So I was thinking it would be a good idea to ask each other these questions. So we'll go through them because I think that they will sort of encapsulate well most of the things that we have talked about
Yeah.
this month so far. So I'll ask you first,
Okay.
Laura, is psychologically informed care something that we do or a way we think?
So I
Good
should be
luck.
prepared, right? But I'm gonna wing it. Um, so yeah, I think if the question is something like, is psychologically informed care something we apply, or
Hmm.
is it a way in which we approach clinic? I could answer
Hmm.
that question, I think, because I think it's not like a mode of treatment. It's not like as a physiotherapist, you might think of treatments like okay, I can choose between exercise or manual therapy or electrotherapy. Look at me being all physio.
Hmm.
Or psychologically informed physio, right? Like it's not like I think that somehow is sometimes how it's kind of understood and
Hmm.
sometimes how it might be taught that it's like this it's this extra tool in your toolbox, and I think that is misleading. I think that it's not an extra tool. This is not an optional way of understanding physiotherapy. Any physiotherapy is cognitive and behavioral change therapy because you are asking somebody to do something that they weren't doing before they walked into the room, right? That's behavioral change, yeah? In order to do that well, we have to understand what goes into changing behavior and what are all the barriers. And if we are sincere in our approach and saying, we think that this change in your behavior is going to make a profound difference in your quality of life and your symptomology and your disability experience, then we must equally value supporting people through that process rather than just being like, do this. You know,
Mm-hmm.
like it's so offensive to the therapeutic process that physiotherapists are trained in to not have these skills, to not understand what the barriers are, because it turns physiotherapy into this very superficial, two-dimensional, um, I don't know, disconnected way of doing relational work, which is what all therapy is. You know, it is in the job title. If you call yourself a physiotherapist, you are calling yourself a therapist, which
Mm-hmm.
means that we're doing relational work and we're supporting people through this process of living with conditions or changing their conditions in a world that might make that quite difficult, right? And I think the 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 difference between being a physiotherapist and being a psychotherapist is you might only have one framework that you can use. And so it might be more like CBT and it might be more like ACT, because these are more focused on actions and goals and like goals focused change. Um, They've got a stronger focus on pragmatic tools, practical application, things that the person can use to overcome the barriers that they're experiencing. So it sits really nicely within physiotherapy and doesn't require us to be, you know, able to intervene directly on things like mood and, you know, childhood trauma and things like that. So that's where the choices come in how you apply, which frameworks you choose to engage with, how you make that sit in your physiotherapy practice, where where your scope is. But so to acknowledge that physiotherapy is sat within the psychological field, I think is not an optional extra. It should be just part of how we understand physiotherapy, that we're dealing with humans and humans, they're not shoulders, right?
Mm-hmm.
And even shoulders are not perhaps shoulders in the way we would have traditionally understood anatomy. It's a living, learning, evolving piece of a human body that is not separate from the human or the human's world. Yeah.
Mm-hmm.
Does that make
Yes. Yes. It makes a lot of sense.
sense?
Yeah.
I've only had one coffee this morning, so no.
Yeah, no, that makes sense. Yep, for sure. Um, okay, so I'll just ask myself the next
No,
question.
I'm going to ask it to
Oh,
you
okay, okay.
because that's the deal, Christine.
Okay.
So, okay, what barriers in your setting make psychologically informed care difficult?
Hmm. Well, I mean, I was thinking about this answer a little bit as well while you were talking, and because, it's you could answer a lot of these questions similarly.
Mm-hmm.
And I think that, I think culture, like what you're sort of getting at there, right? Physiotherapy culture is one of the biggest barriers maybe to psychologically informed care, right? It's this idea, like what you were saying, that people think it's another tool in the toolbox, something that we do, but it's actually more of a whole philosophy framework and a whole approach, right? One of the things we talked about in the discussion as well was that it's not just about the specific intervention that we're giving necessarily, the choice of intervention, but it's also about how we are setting up the whole environment, the whole
Mm-hmm.
experience for the patient, how we're dealing with our colleagues in the relationships there, and everything that's sort of involved in relational work
Mm-hmm.
is part of being a psychologically informed therapist or physiotherapist. So I think that that's a big barrier culturally within physiotherapy because it can be very difficult when you're sort of coming from this one framework, let's say, or philosophy, whereas other people are sort of meeting you on a different
Yeah.
sort of different perspective, a different philosophy of care. So you're sort of talking like this, and it's hard
Yeah.
to meet each other.
Yeah.
And I think that that's a barrier that we also don't have a lot of support within the community and within the culture of physiotherapy to figure out how to develop this as our philosophy and as our approach to care in general. Um, but of course, there are, and you can see that on every level. You can see that
Yeah.
within yourself, right? These conversations that we have a lot about scope. People
Yeah.
are very concerned about where are the boundaries of my practice and am I
Mm.
overstepping? And, a lot of insecurity around what you're allowed to touch and what you're not allowed to touch in terms
Mhm.
of maybe psychological factors that are involved in as barriers to this person's outcome, health
Mhm.
outcome. Um, Certainly, you can see that. So, your own personal level, how colleagues might perceive that, whether that's
Mm.
correct or incorrect, how patients might perceive that as this is
Mm.
not what I'm here for.
Mm.
Um,
Yeah.
okay,
That
there are,
line, that
yeah,
body mind line is
yes,
like it has very, very real impact, not only on how we teach clinicians, how we supervise them, how we guide them, but also how we build the system of physiotherapy. And then what happens is we have this sort of feed forward loop because then
mm,
the patients come in with this expectation of what we have told them physiotherapy is, I think.
yes. And
Yeah.
I think that other barriers are as well. We were talking about this in the discussion too, is just skill, right? Like there
Yeah.
are skills involved in being psychologically informed, of course, like
Absolutely. I love it when I'm told, oh God, sorry, I'm going to interrupt you because this is such a
Mhm,
personal thing. And I'm sure you've had this experience as well, where
mhm.
you're talking to another clinician who says something along the lines, and it comes from a good place. And this is not negative criticism. It's just, I think, shows how much we don't understand the breadth and depth of becoming psychologically informed. Where someone says, well, I do a little bit of therapy with them. I listen to what they've got to say, and I'm like, that's asking them how they feel, asking somebody how do you feel, and that or valid like that's not it. That isn't this psychotherapeutic skill that is being
Mhm.
able to, you know, mirror back to someone when they're using unworkable actions, or when they've got stuck in an avoidance loop, or when they're using negative judgment. It's being able to catch that unhelpful coping strategy in the moment and hold it for them, even when it's uncomfortable. That's the therapeutic skill, you know.
Right. So something we were talking about, like I said before as well, was, the difference between being an empathetic listener versus,
Yeah.
having a psychologically informed approach
Mm.
to care. And, empathy is, of course, extremely important. Empathy and compassion for your person, patient's or client situation. I think that's foundational to this kind of
Mm.
work. But just listening, asking how they are,
Mm.
giving reassurance. Um, this is There is some skill in that, of course, right? To be an active
Mm.
listener and
Mm.
to validate people's experience and to reassure for sure. And it's important to be able to have that as well. But that is just the baseline, I would say.
Mm. Yeah.
And, the skills that are involved in being able to recognize what are some of the, more psychological barriers in this person's health outcome, and also intentionally try to build on some of those psychological principles that we were talking
Yeah.
about, right? Like even building a therapeutic alliance, right? We talk
Yeah.
about that a lot in
Yeah.
physiotherapy, of course, because we all
Yeah.
know from the research that that can have a massive impact on outcomes.
Right. And when we
But
talk
being
about
able to
therapeutic
do
alliance,
that, yeah.
we're
Mhm.
talking about a Freudian, a sort of an analytic, a psychoanalytical principle that, Freud was describing. So even when we say that, we have to be able to acknowledge and observe in our own language how deeply embedded we are in the psychological field.
Right, right,
Yeah.
right. So yeah, that's part of your skill package, I would say, right?
Yeah.
Like we're utilizing terminology that we already acknowledge is important and processes that we already acknowledge as important, but doing that in a skillful way, right? So maybe someone might say that building a therapeutic alliance is just creating a sort of that empathetic sort of listener
Mm.
type of relationship with somebody, whereas someone who is maybe coming more from the psychologically informed philosophy framework would say, okay, that's important, of course, to build a therapeutic alliance in the sense of a safe space so that you can challenge things that you believe or you think are getting in the way of that person, right? So it's not about also changing every belief that maybe you don't agree with or whatever, but
Yeah.
it's also being able to determine what are sort of the unhelpful beliefs, what
Yeah.
are the helpful beliefs,
Yeah.
what are we sort of moving towards, what are we trying to challenge, what are we and unpick versus what are we trying to just leave
Yeah.
alone, right? There's a lot of intentional decision making
Yeah.
in that process, and what kind of therapeutic alliance am I trying to create based on how I perceive this person to be, how they're responding to me.
Yeah.
So I think there's a lot of skill involved in that, and we I think we lack that on a professional basis. And
Yeah.
I certainly would like to upskill a lot more in a lot of these areas and or in general. And I think that, yeah, well, there's not enough focus on that. So I think that that's a big barrier
Like culturally, yeah.
culturally. Yeah.
Do you perceive, like, so a question that I get asked quite commonly is about systemic barriers, like particularly time. What is the role of time and session timings in being a barrier to physiotherapists doing psychologically informed care? Like in your own experience or what you've heard from other people, or
I don't know. I think I'm of two minds of that because I think in the beginning you need more flexibility with your time. I
yeah,
think, and that is a big barrier. So it's hard to because you don't know sort of sometimes where sessions are going to go in the beginning, right? Like you're
right,
dealing with a lot of new information and you're trying to sort of calibrate towards what that person is presenting to you, what they're looking for, what they're saying is going on. And yeah, sometimes you need more time just to
yeah,
figure that out. But of course, you can always use your time after if you have it to sort of
mm,
reflect on we should be, but that's if we're talking about a systemic problem of time, I think that would be probably one of the biggest issues is
right.
that
So it's the time between,
yeah,
not the
there's not
time
enough
with.
time between, but also the time after and the process of reflecting
Yeah,
afterwards, right?
yeah,
Using time to reflect on what happened and evaluate
yeah,
how we were in the session, if we got what we wanted out of it, if it went, how did it go, all that kind of stuff. So I would say that, but obviously, like you can have very effective short sessions.
yeah,
Sometimes too much time is also maybe a
right,
bit of a problem as well.
yeah.
Sort of like how if you give a task 10 minutes versus an hour, you'll get it done in 10 minutes. If you give it 10 minutes, and it'll take an hour if you give it an hour. And sometimes that can also be the case for
Yeah.
sessions.
And I think I love this. Oh, sorry, you brought up this question in me now about flexibility of time.
Hmm.
And I think this is something that one of the reasons I love being self-employed is that I can offer this. But like, being able to stretch a session out but like, I can stretch out to 55 minutes. But sometimes we're done at 35 minutes. And I'm like, if we keep working on this, we could undo the brevity of this conversation because we're going to carry on now, and it's going to get lost in the sort of trickle of blah, 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 all the other stuff. But actually, we've come to this really important place, and I want us to sit with that. I don't want that to get lost in any extra conversation. And so there are definitely occasions where I'll be like, I think we're going to call it a day here because I think we're done. And I want you to go away with that. And that might be 35 minutes. It is so fixed and normed that it's like we say you get this and therefore you get this in terms of time. But actually, it's
Mm-hmm.
the expertise that they're getting access to. What would it look like if we could be more flexible, like you suggest?
Mm-hmm. Yeah, I think that that would be a big cultural shift, right?
Mm.
Because I think time and um, intervention are still heavily linked to each other, right? So
Right.
there are maybe some expectations, for example, that, I expect because you said that this session is 30 minutes,
Yeah.
that I will, if you're going to talk to me for 10 minutes, I'm going to get a massage for 20, something like
Right.
that.
Yeah.
And that's, I think, yeah, I mean, maybe it's not as blunt as that, but that's just a sort of example.
I mean, I think there are physiotherapists out there who would say it is that blunt. I think there are other physios out there who are very much getting that message, like, you must touch every patient, or
Hmm.
you must have every patient must leave with an exercise. And once we start standardizing, we remove the autonomy of the clinician to flexibly respond to the person's needs, which might be less exercise, might be not
Hmm.
touching, right? Might be,
Hmm.
especially when I think about like some of my patients with, neuropathy or CRPS, like they come through, they're doing so much. It's a full-time job. And actually what we do is we reduce all of that down and say, how about life? Because
Hmm.
but I think people do get that message that
Hmm.
this is what physiotherapy is,
Hmm.
and I think that is an enormous barrier to us implementing change, like this kind of framework change where we value ourselves as experts in our field.
Yeah, I think that that's that's the idealized way, I think, like that's what it
Yeah,
should be.
yeah,
Um, but I think that that's also, just to come back to that other example, right, of like the time-based and,
yeah,
massage and all that kind of stuff. I would say that there are, and I don't know, I think this is a cultural thing, this is a systemic thing, but I think that there is an argument to be made, but there are, a certain amount of patients coming in who are not there for your
mhm,
expertise, and they're there for a service, and that how that's been created exactly, um, is, a part of a bigger picture, I think.
mhm.
But I think that that's also, yeah, that's, part of the barriers of trying to work sort of in this way.
Yeah,
Um, so it's hard, it is tough because that's the reality, I think, of working every day. Um,
yeah. And I think there is a much bigger conversation there. I think you and I, we know how there's a much bigger conversation there around what it is to be a patient and to go into healthcare, and especially with
exactly.
chronic conditions where you've been through the ringer so many times and not listened to, that often people come in closed, coming in, you know, in the spirit of self-advocacy, which so I think that is a whole other conversation.
Hmm.
But I think we also do put out this idea that physiotherapy is a certain thing.
Hmm.
And and I think I saw a post recently, and I can't remember who it was, but it's been a conversation that's been knocking around for a while. That's like when we when we conflate physiotherapy with physiotherapy interventions. So it's not a profession where you may get where we may make choices around how we like therapeutic choices around what we do with patients. Physiotherapy is manual therapy, you know, and it's like that conflation harms us as clinicians as much as it's harming patients and people who access our clinics and practices. Yeah, I think
Mhm.
that's a tricky cycle for us to intervene on, isn't it? And I
Yes.
think it's an enormous barrier. I think this cultural barrier is quite huge. And I think our colleagues are sometimes, you know, you look at Instagram and you're like, oh no, it's still out there with thousands and thousands and thousands of like, if you've got back pain, you just need to do these physiotherapy exercises. And I'm like, first of all, there is no such thing as a physiotherapy exercise, right?
Mm.
It's just exercise and
Hmm.
movement that we made up.
Hmm.
So but yeah. Oh,
Yeah,
I
it's
think, yeah.
complicated. It's very complicated.
Yeah.
But I think, talking about time flexibility, maybe it's also good for us to stop here as opposed to going through the rest of the questions.
Oh, but I could go on and on about this forever and ever and
Yes,
ever.
of
And
course.
I think I
But we're
think
going to
this,
have another podcast about this
yeah.
theme at the end
Hmm.
of September, of course,
We
where we'll talk
are.
about
Yeah.
everything we've integrated from this paper and then the
Hmm.
next paper that we're going to read.
Yeah.
And yeah, that's
And
mhm.
and we're going to link the paper in the show notes, right? And like it is, you know, we this paper this is a very nice, easy to read paper. It's very accessible and I think very
It's very short.
clearly
Hmm.
it's quite short, so it's something you could probably read on the train. Um, but it also, I think, speaks very clearly to what psychologically informed physiotherapy is in a way that is not often put down in words. You know, we are looking at mood, at motivation, at the things that help, you know, at unhelpful beliefs or illness beliefs. You know, like they're very like systematic in what they're saying that they think uh, physiotherapy is already working with these processes, and if we train in them, then we will be able to better operationalize it. Yeah, yeah,
Yeah,
lovely.
nice.
Mm.
Great. So thanks everybody for joining us on this episode. And we can't wait to see you at the next one. If you're curious about the Pain Geeks community, you can check it out at www.paingeeks.community.
Yeah.
And you can join the free part of our community platform where you can see all the readings, you can see the chat room, you can get involved. And if
Hmm.
you're curious to come to the live discussions and have access to the recordings, you can become a member of our Super Geeks part of the
Yeah.
platform. And you can find that as well on the website, how to
Yeah.
gain access to that.
Absolutely.
So either way, you're welcome, and we hope to see you in there.
Yes. Thank you very much.
Bye for now.
Bye.